This is CGTN, China Global Television Network.
We bring you the latest updates on the coronavirus outbreak from around the world. Uganda to finalize clinical trials on a potential breakthrough HIV drug. And fighting corruption, Nigeria replaces security personnel at the country's borders. Hello and welcome to CGTN. This is Africa Live and I'm Karen Roberts in Nairobi. Also coming up in the programme. In business, IMF supports some parts of Kenya's deficit reduction plan. And in sports, IOC insists Tokyo 2020 Olympic Games will go ahead despite the coronavirus outbreak. We begin with the latest update on the COVID-19 outbreak. China reported more than 140 new cases in the 24 hours up to midnight on Wednesday, one of the smallest increases since the start of the epidemic. Over 96% of those cases were in Hubei province, where the outbreak began. China's total number of confirmed cases stands at around 80,000. Over 60% of them have now recovered, but more than 3,000 have died. Guangdong province has reported more than 1,300 cases, followed by Henan and Zhejiang, each with more than 1,200. Outside China, more than 15,000 cases have been reported in 78 countries. Japan has just reported one new case with more than 1,000 infections in total so far. South Korea has reported over 6,000 cases with over 400 new infections. Iran is the worst hit country in the Middle East, reporting around 3,000 cases and over 90 deaths. In Europe, France has reported 290 cases and 4 deaths. Italy has seen over 3,000 cases and over 100 deaths. That's the largest outbreak on the continent. In Africa, the North African nations of Morocco and Tunisia, as well as Senegal in West Africa, have reported new cases of COVID-19. These new cases confirmed in Africa now bring the total number of coronavirus patients on the continent to 26. CGTN's Wilkista Nyapwa reports.
The number of confirmed cases of the new coronavirus has now risen from 2 to 4 in Senegal. The latest 2 patients are of French and British nationalities. One of the patients is a 33-year-old British woman who arrived in the capital, Dakar, on a flight from London. The second confirmed case is a 68-year-old French resident whose spouse earlier tested positive for the virus. Following the outbreak, President Macky Sall has cancelled all his trips until further notice. The government has also cancelled celebrations to mark the National Health Day set for 7th March and the International Women's Day scheduled for 8th March. In Algeria, the number of confirmed COVID-19 cases has risen to 17 after 9 new cases were registered on Wednesday night. The cases include an Italian man and 16 members of the same family. The family last month hosted a man and his daughter, both of whom tested positive for coronavirus after flying back to France. In Gabon, the government has suspended the movements of all foreign diplomats and NGO staff in the country. The government has also advised against entry of any diplomat currently staying abroad. Zimbabwean President Emmerson Mnangagwa has also banned civil servants from foreign trips and urged other Zimbabweans to restrict their travel, especially outside Africa, as part of measures to minimize the risk of being exposed to COVID-19. And in Kenya, the High Court has ordered the state to present its coronavirus control plan to the court by 6th of March. The country has not reported any cases of coronavirus. Bulkisa Nyabwa, CGTN.
Health authorities in Italy say that 107 people have now died from the coronavirus outbreak. More than 3,000 have tested positive. The country has announced that all schools and universities are going to be closed until the middle of March. Ross Cullen reports now from Rome.
A major shift to try to get a handle on the outbreak as the number of dead continues to rise. The government's so concerned about Italian healthcare that it's closed schools for millions of children to stop the spread.
We feel that it was the right thing to do. We're concentrating on fighting with all possible measures to either contain the virus or to delay the spread of the virus, because we have hospitals and a health system that, no matter how excellent and efficient they are, risk being overburdened.
As well as the closure of educational institutions, there's also the possibility that another quarantine zone could come into force here in the north, near Bergamo. This move to close all schools and all universities across the country represents a major shift for the Italian government from previous policies, showing a step up in the seriousness of the issue at a national level. But despite the fact that Italy is suffering from the highest number of fatalities in Europe, the public is not panicking, but instead being cautious.
Yes, I'm very worried. We take precautions like maintaining our hygiene, keep the environment clean and sterile as far as we can, but of course there is concern, and it is evident.
I'm not so worried. If it happens, it was meant to be. I'm fatalistic. Of course, if the authorities do their duty, we will all do the same.
I think there is no effective way to protect yourself 100% from the infection, so I'm trying not to change my lifestyle too much. I only take the necessary precautions like washing your hands thoroughly.
But with a worsening situation, authorities hoping their measures have an impact, trying to contain the spread and control a coronavirus outbreak. Ross Cullen, CGTN, Rome.
Coronavirus cases in the UK increased overnight to 87. Health experts warned that a significant pandemic could be just weeks away. 4 of the new cases involve patients who were infected within the UK. Nicole Johnson filed this report from London.
The message is simple. Wash your hands thoroughly and often, and use tissues and hand sanitizer. This ad is the UK's attempt to slow the spread of coronavirus with a TV, radio and social media campaign. And the government has now declared coronavirus is a notifiable disease, allowing companies to claim insurance for losses due to the virus. UK Prime Minister Boris Johnson also announced the introduction of an emergency law to widen access to sick pay for those with the virus.
If they stay at home, and if we ask people to self-isolate, they may lose out financially.
The government is estimating a worst-case scenario of 80% of the population being infected, and at its peak, a fifth of the UK workforce could be off sick.
The incoming Bank of England Governor, Andrew Bailey, says small to medium-sized companies will need financial assistance to cope with the impact of the outbreak.
Of course, this is going to be the first most pressing issue that we face. It's evolving very quickly, and it's evolving in many ways in unprecedented and unexpected fashion.
Hospitals have been asked to carry out more consultations via video links. The government also says it may close schools and cancel public events.
It's definitely getting slightly a bit more worrying, yeah.
Working from home isn't an option for me because I work in schools, so I can't work at home.
Boris Johnson is urging most people to carry on with business as usual. But as the public becomes even more concerned, these times are clearly anything but usual. Nicole Johnston, CGTN, London.
In the US, California has declared a state of emergency after confirmation of 53 coronavirus cases. A total of over 150 confirmed cases have been reported countrywide and 11 deaths. 10 of them are in Washington state. Jim Spellman has more on nationwide efforts to curb the epidemic spread.
As COVID-19 spreads here in the U.S., public health officials are facing tough questions about how best to respond. Lawmakers on Capitol Hill appear to have an agreement on emergency funding to fight the outbreak. There are concerns in the U.S. that there aren't enough reliable test kits. On Tuesday, Vice President Mike Pence, who is coordinating the federal response to the outbreak, said that by the end of the week, there will be enough kits distributed to test 1.5 million patients, enough for any American to be tested if their doctor finds it necessary. On Capitol Hill, Dr. Anthony Fauci of the National Institutes of Health once again said a vaccine is a year to a year and a half away, but that therapeutic drugs to treat people who already have the virus are expected to be ready much sooner. NIH has begun testing on patients in Washington State and Nebraska.
A clinical trial will be done, and if in fact it's shown to be effective, maybe not perfectly effective, but at least somewhat effective in bringing down viral load, we would imagine in the next several months, and it'll take that long to do the trial, that we might have an intervention.
Local governments are preparing for the virus to spread. New York City has increased cleaning and disinfecting throughout the subway system. In Washington State, where the biggest U.S. outbreak has been, officials are bringing in modular housing that could serve as quarantine quarters if needed, and some businesses are encouraging employees to telework if possible. We haven't seen anything resembling widespread panic, but many Americans are preparing. We've seen people stockpiling everything from groceries to hand sanitizer to masks. Masks are almost impossible to find, and stores are running low on other items as well.
It's kind of freaking me out a little bit, so I'm trying to get all the supplies. Actually, I went online to Amazon to get masks, and I actually went to the drugstore across the street to get some masks, but they don't have it. And then I went inside here. I see that the supply is getting pretty low.
On Wednesday, President Trump met with airline executives. That industry has been one of the first hit economically due to the COVID-19 outbreak. Jim Spellman, CGTN, Washington.
Well, with more cases being confirmed globally, some hospitals outside China are contacting doctors in Wuhan to learn from their experience. Su Xinshen attended a conference call between doctors from Wuhan and Italy.
I'm now inside Wuhan's Tongji Hospital, and doctors are speaking with their counterparts from Italy. With over 2,000 confirmed COVID-19 patients in Italy, it is now the hardest hit country by the virus in Europe. And these conference calls serves as a platform for Tongji doctors to share what they have discovered right here in Wuhan.
A Skype call connected doctors 9,000 kilometers apart. It goes well, though the signal freezes from time to time. Dr. Enrico Ammirati, a cardiologist from Uganda Hospital in Milan, asks what type of protection gears Wuhan doctors use.
What kind of suit and mask do you wear?
Okay.
I kindly ask you if you can write down which kind of mask and protection do you wear in the intensive care unit and in the ward.
Emirati's hospital now has converted an entire building to treat COVID-19 patients, but medical staff lack protection. They have surgical masks, but it doesn't offer the same level of protection as the medical-grade N95 masks that doctors in China wear when they enter quarantine areas. Doctors from Tongji Hospital also answered questions about confirming a COVID-19 infection as well as medical treatments at different stages of the disease. The exchange lasts about 45 minutes. The doctors agreed to schedule more conference calls. CGTN spoke with Dr. Zhou Ning, one of the 3 doctors from Tongji who joined the session.
The exchange between hospitals and doctors from overseas and in China is necessary. We are medical workers at the front line who have a lot to share. I think I have the obligation to share what I've learned with doctors around the globe.
That includes ways to prevent a community spread of the virus, how to treat severely ill patients, and protecting medical workers. Dr. Zhou himself, in fact, has recently recovered from the COVID-19 virus.
Over 2,000 medical workers in China have been infected. Some have passed away. We learn lessons from the hard way: how to protect medical workers, how to wear protective suits, masks, goggles, and face shields. We should share these details with doctors from the world so that they can reduce their chances of infection.
It's not just Italian doctors reaching out to Wuhan doctors for their help. Earlier this week, a hospital from New York City asked doctors at Chengdu's West China Hospital for their help, and they've been sent here to Wuhan, saving people's lives for the past month.
During that conference call, the main topic was how hospitals in New York, with just 1 confirmed case at the moment, can prevent an outbreak. Xu Xingchen, CGTN, Wuhan.
South Sudan's government says it doesn't plan to stop its citizens from travelling to and from China as the country battles coronavirus. The Health Ministry says it currently tracks down all travellers entering South Sudan from China to ensure the spread of the virus is contained. CGTN's Patrick Hoyt now reports.
Travellers arriving in Juba are being screened for coronavirus, but the government says it won't restrict freedom of movement. There are 24 South Sudanese students in Wuhan, the epicenter of the coronavirus. Juba says those who have completed their studies are free to return, but they would be put under observation.
Anybody coming from China who have spent less than 14 days since their travel from China, we have their records, we have their addresses, we have their phone contacts, and we visit them at their places during those 14 days.
The health system in South Sudan is already struggling with the existing workload and poor infrastructure. Beijing is assisting Juba in building health centers. It is funding the expansion and modernization of Juba Teaching Hospital at a cost of $33 million.
We are also discussing with South Sudan on the construction of an infectious disease prevention center in Juba Teaching Hospital in future.
With support from the World Health Organization, South Sudan established a screening center at Juba International Airport.
The capacities built through the leadership of the Ministry of Health during this period of Ebola has now made the country more prepared to tackle this kind of diseases that comes up.
The World Health Organization has already declared the coronavirus outbreak a global health emergency, partly because of fears that poorer countries such as South Sudan may not be able to adequately cope with an outbreak. Although there have been no reported cases here so far, the government insists that it is taking all measures necessary to prevent the spread of the disease. Patrick Hoyet, CGTN, Juba, South Sudan.
China has provided Uganda with coronavirus testing kits. The Ugandan Health Ministry says that although the country has not reported any confirmed cases of coronavirus, the risk posed by the outbreak remains high. CGTN's Michael Beleke has that report.
When it comes to diagnosing coronavirus, not all countries are prepared. Many African countries have had to send samples elsewhere for testing. That means waiting several days for results. Armed with kits from China, Uganda can now diagnose suspected cases and take the right actions to contain the spread.
As government, we've received support from People's Republic of China. The support that we have received is towards testing. We've got the strips that came from China, the testing reagent.
Uganda is prioritizing surveillance and screening at airports and other major entry points. It hopes that it will ensure cases are detected and isolated quickly. The Ministry of Health has also issued guidelines for the public to follow in order to keep the coronavirus away.
No handshaking, no hugging. And we are telling the country, those who wish to organize events, they should work together with the relevant ministries like my ministry to ensure that everybody who goes to that place has to go through the procedures that have been given.
Anybody entering Uganda from a country with confirmed coronavirus cases will be isolated and monitored by the health surveillance teams. That's regardless of whether they are showing any symptoms. So far, more than 720 travelers have been isolated for monitoring. About 40% of these have completed their mandatory days of isolation. Michael Baleke, CGTN, Kampala, Uganda.
We are going to a short break now. Don't go away. Lots more to come, including Uganda to finalise clinical trials on a potential breakthrough HIV drug. And fighting corruption, Nigeria replaces security personnel at the country's borders.
How will your world change today?
What happens here? What happens there? Or what you make happen for yourself. If it matters to you, it matters to us too. Your stories are the stories that need to be told. Africa Live. Find your voice.
Nigeria's President Muhammadu Buhari has ordered the immediate replacement of security operatives at the country's borders. Border security agents allegedly allowed nearly 300 petroleum tankers through the borders without authorization. CGTN's Kelechi Emeklem reports.
President Muhammadu Buhari pronounced the closure of the country's land borders some 7 months back. Among other things, government's plan was to curb smuggling. But there are reports of irregularities. The biggest and most recent is the release of 295 smuggled petrol tankers.
The reality is that the border situation is in a terrible circumstance. The agencies involved in border, they allow them to support, this policy by government, and that means there is a thriving smuggling economy within that region. Now, smugglers have money, enough money to attempt to bribe these officials.
Meanwhile, President Buhari has called